Okay, today we're going to talk about forces of injury. And first we're going to talk about the mechanical forces of injury. We talked about it takes a critical force to cause an injury, so we're going to talk about those forces today. First you have tension. Tension is when they pull apart, as you see from the diagram up here, this is tension. So those forces are pulling away from each other at a center point. So tension is force that pulls or stretches the tissue. Force that pulls or stretches the tissue. An example, a muscle strain due to excessive tension applied to the muscle. So the muscle is so tight and you try to take off, it pulls so hard that it causes the muscle to tear, causes the muscle fibers to tear in the middle. So it takes a tension force to cause that to happen. As you can see from this guy right here, he has a hamstring strain. But that's what we're talking about. It's a tension injury. Okay, next we're going to talk about compression. Here's your compression force right here. It's two forces pushing together at the same time. It's a force that with enough energy crushes the tissue, so it smashes, it crushes. When you have two forces coming towards the same point, it crushes. Kind of like when you take an aluminum can and you step on it, it smashes that aluminum can. It crushes. Arthritic changes, fractures, and contusions are commonly caused by a compressive load. So it's pressure at 2 points. And when we say arthritic changes, that's where you start getting compression of the cartilage in the joint, wearing down. So that compression causes them to break down. Or fractures, you can have where two forces push on two ends of the bone and it crushes the bone. Or even when somebody's stepped on or punched, that's a compression force that crushes the tissue. As you can see here, we have an example of this guy who's a boxer. It looks like he got his eye punched pretty good, but that's compression force that causes that eye to bleed and get the bruising. And I don't know whether that's his head or he's got a big contusion over his right eye also, or maybe he just has a big ape-like head. I don't know. But I think that's what's going on there anyhow. But he does have a compression injury around his eye. Next we have a shear force. It's two forces pulling in opposite directions, but as it says here, it's a force that moves across parallel to the tissue organization. So it's kind of pulling them at the same time. It would be like lengthwise, like your muscle fibers are running this way, so it's pulling your muscle with your muscle fibers, but it pulls across at the same time and you get a shearing force. This is commonly seen in injuries such as blisters and vertebral disc injuries. So it's a rubbing back and forth, going the same directions of the tissue. As you can see here, it's also like with this basketball player here, she's trying to drive inside and post up for a layup, but as she's posting up, her lower leg goes one direction, her upper leg goes the other direction, and she tears her ACL as it collapses in, and you get a shear force that tears her ACL and maybe other structures in the knee. But that's a shear force. Now let's also talk about wound classification while we're here. Let's talk a little bit about the anatomy of the skin. Right here you have the skin. What you can see on the surface is basically you're going to see the outer skin layer, which is the epidermis, or the top layer of the epidermis, and you're going to see the hair coming out. And you might even see some sweat glands coming out at the top. You'll see the top of them. But underneath, you see right here, this small area here is your epidermis. And then you'll have a little sweat gland that goes down through that and even into the dermis. And then underneath that you have your subcutaneous tissue, which is usually like your fat layer. Right here you have your hair follicle where it comes out. You have your sebaceous gland, that's where it secretes oil and it comes out around your hair. That's why you have to shower, that kind of stuff, where if you don't wash your hair, you get oily hair and it gets all nappy. Obviously you have nerves of the skin, that's why you can feel things when you get scratched or cut. And then you have a few muscle fibers going through, and you even have some capillaries, veins, arteries going through that area too. Friction blister. It's continuous rubbing of the skin, and it causes a collection of fluid below or within the epidermal layer called a blister. It's continuous rubbing of the skin causes a collection of fluid below or within the epidermal layer called a blister. Here's a great picture right here of a blister right here. This guy had one on his heel, or girl, rubbed enough that it caused the blister, the friction, and then it popped. Obviously, it leaves you that, what it looks like right there, the skin kind of folded up in your irritated area underneath. But that is a blister. Abrasions are quite common. The skin is scraped against a rough surface. The epidermis and dermis are scraped away, exposing the capillaries of the skin. There it is right there. This football player, or I guess it could be a lacrosse player, has a turf burn on their arm, but that is an abrasion where it scratches across. This can happen even if you fall on the concrete or something like that. It's just a scraping. Or what some people say, hey, I just have a scrape. Incision. This type of wound occurs when the skin has been sharply cut. It has one definite line for the cut. Sorry, I went past it right here. So you can see on this heel, there's one line right here, and it's finely cut. That's an incision. Obviously, this person here is probably going to have some stitches or some staples, but that is an incision wound. Okay, next we have a laceration. This is a wound where the skin has been irregularly torn. So you can see right here on this guy's eye that comes up, see the jagged edges? That's irregularly torn. You don't have that fine edge or sharpness of an incision, so this becomes a laceration. Skin avulsion. The skin that is torn to the extent that the tissue is completely ripped away from its source. So right here, thank goodness is this just a model of, I couldn't find a good picture of it anyhow, but the skin is ripped away and you'll get some bleeding and you may see some underneath lying tissue, maybe bone, muscle, that kind of thing, but it's an avulsion where it tears away. Right here you see the skin torn away from the skin. It's a skin avulsion. Puncture wound. A penetration of the skin by a sharp object. It could be a nail, it could be a piece of glass, it could be a screw or a screwdriver, but what it does, it punctures the skin, it leaves a smaller wound, and it usually goes pretty deep. This is kind of an example here. It looks like they may have got a puncture wound by a nail or a screw or something like that. Contusion or bruise, when a blow compresses or crushes the skin surface and produces bleeding underneath the skin. It's compression force, remember that causes this. And there it is right there. This is also just a hand diagram. This is not a real one, but that's a great picture of what it does. It bruises, you get that purplish red color. That is a contusion or a bruise.